Hello, my name is Jay. I'm a pathology resident. I'm in my fourth year prepping for the boards. Let's go over the cytology case because I'm on cytopath rotation right now. Thank you to Path Presenter. The clinical history is a 3.5 centimeter pancreatic head mass in a 55-year-old male. So here, from low power, we see some scant cellularity. So let's zoom in on these areas of cells. On intermediate power, we see some cohesive groups, and maybe this is mucin, but depending on where they sampled the pancreas, that mucin can be from the stomach, from foveolar cells, or it could be from the duodenum, or it could be from any pancreatic mucinous entities like mucinous cystic neoplasm, intraductal papillary mucinous neoplasm, or IPMN, or pancreatic ductal adenocarcinoma, or PDAC for short. Now seeing this kind of like mucin in this cohesive cluster of cells, I'm concerned that the mucin may be from a neoplasm in the pancreas. In this, we see very hyperchromatic cells, and with nuclear anisonucleosis, where this cell is smaller than this cell. This cell is much smaller than this one. So I would think, or I would agree that we have 4-to-1 anisonucleosis, which is one criteria for diagnosing pancreatic ductal adenocarcinoma. Some other criteria that my attendings have taught me is a drunken honeycomb architecture. Here, these cells aren't organized into concrete spaces. These are kind of overlapping, so I consider this a little bit of a drunken honeycomb. And then another nuclear cytologic feature is PTC-like nuclear features. PTC is papillary thyroid carcinoma, and it usually has this like pale chromatin with a eccentric nucleoli, kind of like this. So I am concerned with pancreatic ductal adenocarcinoma, and this case turned out to be PDAC. But you can just appreciate how atypical some of these cells are. If this is your lymphocyte here, you can put maybe even like more than 10 in this nuclei, this bizarre nuclei. Here you can appreciate better some of the drunken honeycomb and some of the PTC-like nuclear features. It has like nuclear grooves, which is akin to like the grooves you see in coffee beans. It has that eccentric nucleoli. It's got like a lumen, so it's a adenocarcinoma, and it's got that 4-to-1 anisonucleosis. So I would be comfortable, if this were my case at my institution, and if I were the attending, I would be comfortable calling it malignant. And then it would be with, there's a lot of responsibility in calling that, because if you do call it a malignant, that can buy the patient a Whipple procedure, which has a lot of morbidity. So you really want to make sure that you see good 4-to-1 anisonucleosis, and drunken honeycomb, and PTC-like nuclear features. Here we see a really good 4-to-1 anisonucleosis. Oh, one thing I forgot to mention that I didn't appreciate before during my first year pathology residency is this 4-to-1 anisonucleosis. You can't count, like if you see a large cell, you can't compare that to another distinct group of cells and look at that one. It has to be 4-to-1 within that same group. So here we have 4-to-1 within that group. So that's something to know as well. And here we have some mucin as well. This kind of like snot-like substance is what I equate to, what is mucin. All right, well, that's it for today. I'll see you in the next time. Bye.